Hi, this is Dr. Dennis Gindia. We're going to be talking about Prework Module 2E within the behavioral health disorders, and we're going to be talking about suicide and suicidality. So the learning objectives here are that you'll build an awareness of suicide and suicidality, that you'll recognize suicidality as a component of behavioral health disorders, and that you'll build awareness of symptoms that are associated with suicidal ideation. So, in terms of suicide, obviously, suicide and suicidality is a huge issue. This slide talks about the number of people that die by suicide annually. Obviously, it's a very high, disconcerting number. It's the 10th ranked cause of death overall. Obviously, when you think about suicidality and suicide, it's very complicated, but I want to emphasize that it is many times preventable, and that it's preventable by understanding what the warning signs are and how to help that individual get connected with the assistance therapeutically that they need. If they get connected and they get the kind of services they need, many times suicide or suicidality is preventable. One of the things that's really important when you think about suicidality and suicide is the ability to recognize risk. There are risk factors that are associated. What I do want to add to is that suicide is not a normal response to stress. We obviously are in very stressful times, but I want to emphasize that suicide is not a normal response. What suicide or suicidality is a sign of extreme distress. It's not, as what many people think, is just a harmful attempt to get attention. Suicide and suicidality is a strong indication that the individual is in extreme distress and that they need to be assessed and referred to get the kind of help that they need. So the risk factors that are associated with suicide are depression or other mental disorders, and I do want to emphasize that we had a very good discussion around what these behavioral health disorders are, and that I want to emphasize that suicidality can be a part of any of these disorders. So the mental health disorders that we discussed certainly are risk factors, whether it's anxiety, depression, PTSD, schizophrenia, or the dementias that we spoke about. Prior history of suicide attempts is a strong risk factor. A family history of a mental health disorder or substance use issue. A family history of suicide itself. Family violence, including physical and or sexual abuse. Having guns or firearms, in other words, having the means to carry out the suicide, greatly increases the risk. Incarceration or being in prison or jail, obviously, many times people who are in jail become very depressed and have to be monitored on a regular basis for suicide and suicidality. And then finally, exposure to others in terms of family, peers, and celebrities. Unfortunately, we read sometimes about young people who are in high school, where if one person actually, one student in that high school commits suicide, that increases exponentially the risk for everyone associated in that high school. So clearly, being exposed to a suicide, either in family or as a friend or in a particular setting like a school, increases the risk factors exponentially. When you look at the gender piece, it appears that men are more likely to actually be able to commit suicide, where women are more likely to attempt. Unfortunately, and this is a very sad situation, the second leading cause of death for young people aged 15 to 34 is suicide, and also older adults, 65 plus, have a high rate of suicide, particularly white males. So something about white males who are 65 plus, who have high rates of suicide. Again, maybe some of the issues associated could be due to privilege, being very connected to your job, getting most of your worth by, based on what you do. So if you're going into retirement, you no longer have that job. You in a sense lose a sense of purpose, and this could be one of the factors that's associated with higher rates of suicide that we see in older white males 65 plus. There are some very excellent steps that you can take for helping someone who is experiencing suicidality, but asking them if they're thinking about hurting themselves. Again, I would say that many times we don't want to use certain words because we're uncomfortable, but in doing a good assessment, a good risk assessment, it's always good to use very direct language, very direct words. You don't want to mince words. You want to just ask directly. You want to create an environment where you can ask, but in terms of being gentle, but you certainly want to be very assertive about how you ask. You don't want to mince words. It's important to normalize the conversation. You want to try to keep them safe around where they are, around items, if they have the means and so forth. You want to listen carefully and learn what the individual is thinking and feeling. Again, I say that you want to lean into the conversation. You want to encourage the client, encourage the individual to have a conversation about what they're thinking, what they're feeling. And the more they're able to talk about what they're thinking and feeling with you, the less likely it is that they're going to actually commit or actually suicide. You also want to help them make connections so that if they are feeling suicidal, they have someone to call. And you want to make sure that you stay, or you have someone who you can designate that stays connected with them, so that they feel that if they that they are connected, they're not isolated. They're typically they're in a much stronger, better position. So what you've learned here is what suicide looks like, what some of the risk factors are, how suicidality is a component of all of the behavioral disorders, I should say, that we've covered, and how, if you can identify those risk factors, you can really help prevent a potential client from actually committing suicide.